To begin our ceremony, we turn to the first of our honorary awards. As you will hear shortly, honorary awards celebrate the life achievements of individuals who are outstanding in their field of endeavor, and through their determination and their successes, offer those of you receiving awards today role models for the next chapter in your life. It is my great pleasure to call Jane Perry to the lectern to read the citation for today's honorary presentation.
Chancellor, graduates, distinguished guests, ladies and gentlemen, I am delighted and honoured to be delivering the citation for the conferment of an honorary doctorate of science to Kathryn Halford OBE. During 38 years with the National Health Service, Kathryn Halford has helped pioneer cutting-edge medical treatments, saved victims of the 7th of July bombings in London, met royalty and helped thousands of patients. Kathryn has been Deputy Chief Executive and Chief Nurse at Barking, Havering and Redbridge University's Hospital Trust since 2016. In 2018, she was awarded an OBE in recognition of her services to nursing. Kathryn's varied career has involved mingling with celebrities such as Madonna, as well as being at the cutting edge of medical and technological advances, including the treatment of HIV and AIDS and the development of bone marrow transplants in children. Kathryn was a nurse at St Mary's Hospital in Paddington when the AIDS epidemic began, caring for some of the very first patients to be diagnosed with and untimely die from the disease. She vividly recalls having to wear full protective clothing when treating patients, as the disease was believed to be so infectious. Kathryn says, "It has been particularly satisfying to see how advances in medicine and patient care have improved over the years, so that people are living better and longer, and operations have become more sophisticated through advances in technology and medicine." At the Barking, Havering and Redbridge University Hospital Trust, Kathryn nurtures nurses, and she worked to grow the Trust workforce from within. She has helped the University of East London set up a registered nursing course, an offering which was not previously available in North East London. Thanks to Kathryn's efforts, the Trust is a pioneer of the Nursing Associate Scheme, which opened up career opportunities in nursing to a wider pool of people. Kathryn also created an award-winning senior intern scheme at the Trust, providing new nurses with mentoring and support from veteran employees. This has resulted in a reduction in the rate at which newly qualified people leave the Trust. She says one of her proudest achievements at the Trust has been reducing the number of pressure ulcers and patient falls. She says we have reduced falls to amongst the lowest in the country and reduced serious incidents. Kathryn's ambition to be a nurse dawned at an early age after she watched Angels, a television series about nursing. Following her training in Bath in the early 1980s, Kathryn qualified as a registered nurse in 1984 and as a registered sick children's nurse in 1987. Kathryn says, "After watching Angels, I always wanted to be a nurse. I thought it was a really nice job where you are able to help people. A lot has changed in my career, but that has not." Prior to joining the Barking, Havering and Redbridge University's NHS Trust, Kathryn worked at Walsall Healthcare as Director of Nursing. She also spent 14 years at Gloucestershire Royal Hospital, where she rose from staff nurse to matron. She says, "It gives me huge pride to be able to improve patient experience and develop the next generation to be excellent nurses and midwives." Kathryn is married to Roland and has 3 children, Rebecca, Oliver and Freya. Chancellor, it gives me great pleasure to present Kathryn Halford OBE to receive the degree of Honorary Doctor of Science, honoris causa.
Kathryn Halford OBE, on behalf of the Academic Board of the University of East London, it gives me the greatest pleasure, by the authority vested in me, to confer upon you the award of Honorary Doctor of Science, honorary causa. Thank you. Congratulations. That's your proper certificate now. You can go and do your speech.
Thank you for inviting me to address you and for awarding me an honorary doctorate. I am absolutely delighted and not a little surprised to be standing before you having received this honour. But I'm not as surprised as my head teacher would have been if he was still alive. He told me that I wasn't very bright and I was only in the sixth form whilst I waited to go and train to be what he called a little nurse. I am still a little nurse 38 years later. I have enjoyed a varied and interesting career that has taken me across the globe, visiting different healthcare settings and working with some of the brightest and most innovative people in the world. I've dealt with the aftermath of the terrorist attack, cared for some of the UK's first HIV and AIDS patients, and spent a night as the only woman in a monastery. You will soon all start on your careers, and you will only have a vague idea of what could lay ahead for you. When I trained, there were no computers and very little equipment in hospitals. At the end of the ward round, when we had finished discussing all of the patients, the ward sister, and they were always female in those days, and the doctors used to go into the office. My privilege as the senior student nurse was to serve them afternoon tea. We certainly have no time for afternoon tea now. Most of you in this hall will only come into contact with the NHS if you need treatment or if you're having a baby. So you might be wondering what the relevance of my career has to you. I hope some of what I will talk about and some of my experiences will help. In all careers, families and friends are vital and their support is vital. And I would not be here today without the support of my parents, my husband, my children and my sisters. I know that my parents are very proud to be here and I'm delighted to be sharing this very special occasion with them. I hope that this honorary doctorate will in some way make up for me not getting an award when I first qualified. My best friend did, and my mum is regularly reminding me of that. My career has led me to meet lots of different people from lots of different backgrounds, and I have learnt from them all. My career has seen me spend a night in a gay sauna with the sexual outreach nurses, and this experience made me realise that for vulnerable groups, we need to provide healthcare in an environment where they feel comfortable. As a result of this, I went on to set up services for women in mosques and temples, and I worked with health visitors to provide walk-in clinics for young families rather than them sitting in clinics. Your careers are just starting, and you will face in the future many decisions and many choices. One choice I made was to work at the world-renowned Great Ormond Street Hospital for Children. I learnt a lot about medical conditions, leadership and management not only of staff, but also of a variety of celebrities who came into the hospital. The skills you've developed at university will be transferable. I was challenged to summon up all of my skills on the 7th of July 2005 when I was in charge of the Great Ormond Street's response to the London bombings. During that terrible day, I set up an intensive care unit in the dining room, a temporary morgue elsewhere in the hospital, and in the evening I had to get the airspace opened up so that a heart could be flown from Belgium so that a patient could have a transplant in our hospital. I never ever thought I would have to deal with such a dreadful situation, but I discovered that I could harness all that I had learned over the years and respond appropriately. One aspect of my work with very sick children was a focus I had on trying to improve the care of terminally ill children. And this meant I had to spend a night as the only woman in a monastery because I was working alongside one of the monks who was a specialist nurse for a group of terminally ill children. Unfortunately, nobody told me in advance that the monks were a member of a silent order. This became apparent to me and prompted lots of eyebrow raising when I asked for the marmalade over breakfast. For most of my career, I have been very lucky. I have had a wide variety of interesting and challenging roles. But when I worked at the Department of Health, I found it very difficult not to be near patients. I'm a great fan of Yes Minister and Yes Prime Minister. Many of you in the audience will need to look up these television programmes afterwards. I was unaware of how true to life the TV shows were until I actually worked for the government. Your careers probably won't look anything like mine. You should seize every opportunity that arises to make them as interesting as you can. It may well be that the path you set out on will not be the path you ultimately follow. My advice is to enjoy your jobs and make sure you always look for ways to learn and improve. And these may not always come from an obvious source. I can give you an example from my own career. A groundbreaking and award-winning scheme at our hospitals came about after I'd watched the film The Intern. It stars Anne Hathaway, whose character benefits from the wisdom and support of Robert De Niro's character, who is retired but returns to the working world as an intern. This film inspired me to set up my own senior intern scheme. I've recruited a small, dedicated team of experienced nurses who are nearing the end of their careers. They work as mentors and coaches. They have helped to improve new recruits. They have helped to prevent new recruits becoming disillusioned, demotivated and wanting to leave. In the new year, the BBC will film them and the 5 programmes will be broadcast in 2020, which is the International Year of the Nurse. I hope you all enjoy yourselves today as you celebrate the achievements you've worked hard for. I hope you will remember to look after each other, consider the impact you are having on others, and look forward to what is coming next. You never know what it will be, but I'm sure you will continue to learn and develop, and you will build up a bank of great experiences. In closing, I would just like to say how proud I am to have received an honorary doctorate from the University of the East of London, and how proud I am to be a nurse. People remember when they get good nursing care. Still today, when I visit my local supermarket, the cashier tells me about the achievements of her grown-up son, who I cared for years ago when he was a child. I tell the nurses that I work with that we are with people at the best and the worst times of their lives, and they never forget us. Thank you.